Hi everyone, Dr. Kaplansky is here today again. Today's topic is sinus lift. A lot of people have a lot of misconceptions about it, so we are going to talk about it, what it is, when it's needed, why it's needed, and what are the alternatives that may be there. So a sinus lift procedure is literally that. We're not lifting the sinus. We're not. The sinus is a cavity in the upper jaw, which is right on the side of the nose here and right underneath the eyeball. It's on both sides. Now, when I talk about sinus, we're only talking about maxillary sinus or the upper jaw sinus, right? There's other sinuses, frontal sinuses and other sinuses in the head. We only focus on maxillary sinus today. So it's a cavity filled with the air and lined with a membrane. The membrane is very thin. Under normal conditions, when the sinus is not infected or inflamed, the membrane is very thin and everything is healthy and everything is draining and the air is traveling back and forth from the sinus to the nose and back and forth. And it's a very nice, healthy equilibrium and everything is cool and dandy. But sinuses do get infected occasionally. That's when the sinus gets clogged, the membrane gets really thickened, it obstructs the drainage, and then people get sinus infection. But this is not a topic of today's discussion. So I just explained what a sinus is. Now, what's a sinus lift? Again, we're not lifting the whole sinus. We are lifting the membrane. So that really thin membrane that lines the sinus, I have a model over here. So this shows the sinus, and this represents the membrane, this little clear film. So what we do is we elevate that membrane. We put bone graft material underneath the membrane. So we're not in the sinus, we're underneath the sinus. And we grow bone, if we need to grow bone in that area, to be able to replace missing teeth. So why is a sinus lift done? To create bone where there is no bone, to be able to place dental implants. Otherwise, there's absolutely no reason to do a sinus lift. Now, why would someone who needs teeth replaced need a sinus lift? And why would someone who needs teeth replaced wouldn't need a sinus lift? Teeth in the back of your upper jaw, they're anatomically located right next to the sinus. They're either underneath the sinus or on the side of the sinus, or sometimes in the sinus. So sometimes we get these molars, these upper molars that have 3 roots like this, and the floor of the sinus is right in between the roots. Or the root may be in the sinus like this. So you can imagine when that tooth is removed, there is either a hole in the sinus, or we are so close to the sinus that there's virtually no bone in between the sinus floor and the oral cavity. So when that area heals after the extraction, or immediately during the extraction, and we say want to replace a missing tooth there with a dental implant, we have nowhere to place that implant into. There's no bone in there. We cannot put an implant into the air because sinus is filled with the air. So in that case, we would consider a sinus lift. So there's 2 techniques to perform a sinus lift, a lateral and a crestal. Lateral sinus lift is when we make a small window on the side and we elevate the membrane through that small window. We place the bone graft material in there, we cover it up, and we allow that bone graft material to turn into your own bone and eventually come back and place a dental implant in there. Crestal sinus lift is when it's done through the tooth socket or through the area in the mouth where the teeth are missing. So it can be done either through the crest or through the side. These are the 2 varieties of sinus lifts. Which way it's going to be done is totally dependent on an individual patient and on doctor's preference. It's not like one is better than the other. Basically, it all depends. They both work, and both can be successful. Now, what are the alternatives to sinus lifts? If you're replacing an individual tooth, and let's say this here is a missing tooth and it's on the top, like this. And right up here in this area, there's a sinus. And you want to replace that tooth. You really don't have much choice. You can either cut these two teeth and put a bridge on them, or you can elevate the sinus and do a sinus lift and put a dental implant in there. So sinus lift is a fantastic way to replace bone where the bone is missing for an individual tooth replacement. And I'll accent word individual tooth replacement. When we talk about multiple teeth though, when patient is missing all of their teeth in the arch, so some are front teeth and some are back teeth missing, sinus is right here in the back. In the front, there's no sinus. And there's also other areas in the back of your mouth where there's no sinus, so there's some healthy bone in there. Then we wouldn't need necessarily to lift the sinus. We can find bone elsewhere and anchor the dental implants there instead of lifting the sinus. So what are the disadvantages of a sinus lift for immediate implant restoration, which is what we pride ourselves in and what we specialize in? So we would like to give people their teeth right away. We don't like to wait. With a sinus lift, just like with any grafting procedure, you have to wait. With a sinus lift, you graft the sinus and you wait probably 6 to 8 months at least for that graft to turn into bone before you can go back in there and place the implant. With the Teeth Tomorrow procedure, where we replace all the teeth in the arch, in the upper arch, let's say we don't have enough bone where the sinuses are. Traditionally, dentists would go back in there, graft the sinuses, wait 6 to 8 months, patient will continue to wear a full denture, then come back, place the implants, wait again, then give you the full arch of teeth. We prefer not to do it that way. We prefer to give patients teeth right away. So instead of grafting the sinus, we find bone where there's native bone. So we advocate graftless solutions for full arch tooth replacement. Again, it's not for individual teeth, it's for a full arch. So when we do a full arch of teeth, we can find bone where there is bone, whether it's a zygomatic implant or a pterygoid implant. There's implants that go into a pterygoid plate in the back of the mouth. So they're highly specialized implants that require a lot of practice, a lot of training, a lot of expertise that not many doctors have, but we do. So to summarize this, sinus lift is a good solution for a single tooth replacement. Sinus lift may be an okay solution for a full arch tooth replacement if the situation dictates waiting and protracted treatment time. But if we are trying to give patient teeth right away with the Teeth Tomorrow technique, then we would use either extramaxillary fixation such as zygomatic implants or other graftless techniques where we don't have to wait on the graft to mature to be able to place implants. You guys can watch our other videos, especially on the zygomatic implants, to get some more information on that. Hey everybody, thanks for watching us today. It was great fun presenting different options to you. Again, my name is Dr. Kaplansky. If you're looking for a solution for missing teeth, whether it's a single tooth or a full arch of teeth or a full mouth of teeth, we are here to help. Give us a call. My practice is in Guestport. The number is 716-772-7500. And thanks again for watching.